Hello, everybody. Um, I hope you're staying safe from the rough weather. We are having thunder and lightning everywhere and tornado warnings. It's been scary, but I hope you're doing okay. Um, it's glad to have this presentation this morning or this afternoon, whatever time it is. And it's nice to be welcome to give this presentation to this platform. And I was invited by Angie, and it's my pleasure that whatever information I'll be sharing here, you benefit and you like the differences and enjoy yourself. Thank you so much. My name is Richard Areba. I'm a Kenyan RN, and now I'm a US RN. I'm so glad to be in this country. So my training as an RN in Kenya, we have a college in Kenya that trains medical professionals. Mostly we have different cadre of staff. We have RNs, we have medical laboratory technologists, we have pharmacists, we have physician, like the equivalent of physician assistants in Kenya, which is called a clinical officer. And we have medical records people. We also have pharmacists. We have radiology specialists. We all have a college in Kenya that trains these people. And that's where I trained first as an RN. And that course took me 4 years. During this time, you train in general nursing and community health nursing and obstetrics and midwifery. And you do clinical placements in different departments. Like for midwifery and maternity, you are placed for 3 months, where you work in a labor ward, you help women to deliver and do neonatal care. And then the other part of the community health is you are put in a clinical rotation, where you go to the community, and as an RN, you work with the community to identify their problems and help brainstorm on solutions coming from the community to find the solution to their own problems at the community level. And this is the part where I was able to now, that's where I got to like midwifery and obstetrics and mother-child healthcare services. And that's how now Gates of Hope was born. Gates of Hope is a medical facility that I founded in 2015, which has been running, and we have women delivered there so far. Since its inception, we've delivered so far 5,920 women, and we have a program in the facility. We have an innovation for malnutrition, where we have an egg a day that is a solution to alleviate and to cure a malnutrition. So far, we have had to distribute a lot of eggs, and that's how it happened. I have a Bachelor of Science degree in nursing, and the training I did it in Kenya, Kenyan University. And before I did my Bachelor of Science degree in nursing, I did a diploma. That's an equivalent of an associate degree in the US, that went for 4 years in a Kenyan university. And in that university, I predominantly trained on community health, midwifery and obstetrics, and the other general nursing units. I've always wanted to come to the US for so many years. I mean, we have programs to get to the US, mostly visa applications. We have one popular one, they call it a green card lottery application. I've applied that lottery application for the last 15 years, and I never won, or I never got. So a chance came when we learned about recruiting agencies, for international nurses. And we applied. My wife is an RN too, so we had to have one of us apply, and then we file as a family. My wife applied, and she was able to process as an RN. And then for an international RN from Africa, for you to get to the US and practice as an RN, you have to pass NCLEX exam from Africa. And for you to take NCLEX exam in Kenya, from Kenya, you have to, at that time, there was no testing center for NCLEX in Africa. It had to be, the nearest was in India. So my wife traveled to India to go take NCLEX exam, and she passed that exam on the first attempt. And she was 7 months pregnant, I think I remember. So after she passed, then the agency was able to process for us together. And she did interviews from Kenya before she came. And we had choices to choose different medical facilities in the US. So she chose on Memorial Hospital, Jasper, Indiana. And that's how we were able to come to the US. And now we still work at the medical floor of Memorial Hospital, Jasper, Indiana. So far, it's been so nice. It's been good for us. We've had so much going on, especially learning in the new hospital environment. For us, is so different. And so far, we've really had fun. We've enjoyed. We made nice teams. We have met people with a super good and top-notch work ethic, and people who are serious with what they do, and the management of patients is so nice. We so far love it, and we like. In Kenya, I worked for different organizations. That's Ministry of Health. That's a government, private hospitals, and non-governmental organizations. So my main experience was working with government, which is Ministry of Health. Ministry of Health delivers healthcare to the Kenyans in different levels. We have different level of facilities. We have level 2, level 3, level 4, level 5, and 6. Level 2 is the lowest service provision, and that's where mostly I worked. As that's a medical facility that is at the community level. Most of the community level facilities are run by RNs, who are the facility charges. So most of the nurses who are charges, what you do is you coordinate running of services in that medical facility. You have people from the community coming to the facility, and most of the services that are given outpatient, and if there is any case that needs any further attention, you refer to a little bit higher level where they can get more specialized care. So at the lowest level, what we do as RNs is you coordinate immunization, you administer vaccines to children under the age of 5 years using the National Immunization Schedule. You also coordinate HIV provision services. You coordinate TB treatment and testing. You administer antiretrovirals to HIV patients. You do testing for people with TB, and also do treatment of minor ailments. And mostly we do treat outpatient minor ailments using different algorithms, like when you treat for example, UTI, we have a nice specialized formulated charts we use to treat. Like, for example, UTIs, we have an algorithm how you treat, for example, chlamydia, how you treat vaginitis, how you treat gonorrhea, how you treat herpes, how you treat and UTI. Also, we have a special program we call IMCI, that's Integrated or Management of Childhood Illnesses. We have like charts we use to treat kids with severe dehydration, pneumonia. We have otitis media, and also we have like other infections like pneumonia and upper respiratory infections. So at that level, you do assessments as an RN, and you prescribe specific treatment for those kids. And that's allowed in Kenya as an RN. You can do prescriptions, you can do suturing of people who have cuts and like accidents or emergencies, bleeding. You can do suturing and all that. Then at that level also, as RNs, we coordinate maternity and delivery for women and antenatal care. So we see mothers who are coming to seek antenatal care. We do antenatal care profile, where we do general testing and assessment of women if they can deliver vaginally or they need to do a CS. So the work of an RN at that level is to assess these women and make sure they rule out if a woman has like a different type of pelvises, to see if she can sustain a vaginal delivery. That's we have the most common is you have to confirm for sure if this woman has a gynecoid pelvis by doing physical examinations. So that's the work of an RN. We do screening and also get these women to be ready to get nutrition counseling, to know the type of foods they eat, to prevent anemia, to check if they have hypertension, so that we are try to avoid eclampsia and preeclampsia. And then we did mostly testing for malaria, for example, and then we distribute like mosquito nets to avoid these pregnant women from getting malaria. And that's some of the jobs that you do as an RN at that level. So when you are the facility charge of that level facility, you do budgeting and you do finance management within that facility. You use funds that you are given to run services at the facility. My wife also did that same job in a different facility as I was doing. So we pretty much have robust experience in running a medical facility, and that's how we got interested with now opening our own private medical facility. Hey guys, now community health and community health solutions is one of the areas I have personal interest and I love so much. The reason why I love and like community health and public health is you are able to identify the preparedness and readiness of the community to deal with a pandemic, for example, or an epidemic or an endemic infection. And then you are able to study the disease spread. That's the area of epidemiology and disease control. You are able to study how a disease spreads, and you are able to put interventions to prevent spread and also screen for possible cases in the community. I like that so much because it involves going outside, talking to people, administering questionnaires, and also trying to use problem-solving techniques to help the community identify problems they have and then help them brainstorm to find solutions for their own problems. Because you can impose to these people about the solutions you want to put, and if the community is not involved, the reception is going to be so bad and you will not be able to achieve your results. So community health is actually the backbone of healthcare, because then if you are able to identify problems at the community level, then you are able to mitigate and intervene appropriately before now you have patients influxing to the hospital and then get the healthcare system being overwhelmed. And that's how now we will lose so many people from a disease that could have otherwise been prevented. So if we have strength and we have a lot of measures, we have a lot of trainings around disease and infection prevention at the community level, then we will have a reduced disease burden. We will have more healthy living. We will have more people being healthy and avoiding straining the healthcare system of people who are sick, and whatever they're sick from would have been prevented at the community level. So that's the passion. That's my gospel. Like, can we have these problems identified at the community level? And now, do we have testing and diagnostic equipment for us to identify those diseases early before they are advanced, before they kill people, before more people are affected? So that's how, and that's the passion I have for community health. So during my engagements with the communities and working around the community with the people, then there's so many problems, healthcare problems with different kind of populations. We have a spectrum of problems, like we have HIV, AIDS, and infection, HIV, AIDS infections. We have TB crisis. So many people have TB. They have different types of TB. For example, we have people who've been taking anti-TB treatment, and they have now multi-drug resistant TB. There are those kind of problems, and we have different organizations intervening for these kind of problems. So during that time, we identified like one of the biggest problem is malnutrition around children under the age of 5 years. So after we identified this problem, we said, okay, can we come up with solutions or something to help intervene appropriately for these kind of problems? That's how now we came up with this An Egg a Day program. An Egg a Day program is a program where we give eggs to children under the age of 5 years who have indicators of malnutrition, who have clinical signs of malnutrition. They have stunted growth, they have anemia, they have now the specific criteria to classify different malnutritional problems like marasmus and kwashiorkor and iron deficiency anemia. So when we diagnose at the outpatient clinic level kids who have these indicators of malnutrition, then we put them into the program of An Egg a Day. An Egg a Day is a program where they come to the facility under a direct observed therapy, and they get an egg every day. At the facility level, we boil the eggs, and when the kids come in, they get the eggs every single day. They get, and then after a period of time, they get to be weaned from this program when they meet the normal growth indicators. So that's a program that we are working on, and it's going on, and we have kids coming. So far we are looking to hit the numbers and get to distribute more eggs. And fortunately, since we moved to the US and we are now working as RNs in the hospital, we've been able to at least support and buy more eggs because of we get slightly more income. And it's been very transformative that we are able to reach out to at least more people that we are helping right now. So the program mostly it's running in our medical facility, and we have kids coming in, they're being given these eggs, and we are looking to grow and have like a chicken farm where we produce more eggs and be able to distribute more eggs. So the focus is to at least have a 200-bed capacity hospital for women who are giving birth, and children hospital. So when we came to the US and now working in healthcare in the US, we have realized that a lot needs to be done back home, and we have realized the biggest gap we have also is on testing and lab investigations for sick people. So we look at how patients are investigated here or they are being tested here. They request MRI and it's done the same day. A CT scan is requested and it's done almost instantly. So we are looking to build and come up with, start and build on Gates of Hope Hospital to at least make it bigger with more specialized equipment, so that we have people are able to get MRI done, people are able to get CT scans done, people are able to get the right lab testing done, and then at least on timely basis, so that at least we're able to identify and intervene appropriately in terms of management. We've even seen sophisticated treatment tools, like we've seen, like for stroke patients, they have this teleprompter, like the neurologist is able to see the patient in Memorial Hospital, and the neural person is in Kentucky. We want to also come up with those kind of innovations to have even doctors from the US. We buy that equipment, we have it at Gates of Hope in Kenya, and we will have specialized doctors from the US being able to see patients at our facility in Kenya, and then we able to set up our systems in a way that at least now people or different government institutions and private hospitals can come to our facility as a center of excellency to learn the best practices as we are trying to learn here, and then we replicate them in Kenya, and then we'll be able to influence and of course help reduce the disease burden. So we are so privileged and so happy to be in the US. And as US RNs who are looking forward to graduate and do your NCLEX and get to become a US RN, you have the best that you need. You have the best country, and you can become all you can be. And more importantly, also, we encourage that we have RNs who are interested to, like, for example, we can do exchange programs where we have students or RNs, we can travel back together to Kenya and get to experience that firsthand. We can go to our clinic and hospital, we see patients there, you get to even do clinical placements, you can deliver women, you can prescribe medicines for people, and by so doing, we will have the greatest needs in healthcare in Kenya is we have, top tier, majorly we have strained healthcare system where we have not enough hospitals to treat the people that we have in Kenya. We have 50 million people, and most of the government hospitals, they don't have enough equipment, they don't have enough staffing, there's also limited specialized care. Like we have these specialties, we have like neural to treat stroke and neural issues. We have cardiac problems. We don't have enough cardiac centers. We don't have enough cancer centers. We don't have enough staffing in those centers. And then testing and lab tests, and imaging, they are so limited, and then the turnaround time for tests to be done takes a longer time, and then you don't intervene on time and appropriately. So we identify those are the needs, and then also we have infrastructure in terms of now you have people traveling a long distance to go to a medical facility. It takes time, it takes resources where people don't have means of transport to the hospital, and then you find people die from conditions that otherwise could have been prevented or even treated if there was access to healthcare. Also, one of the major issues we have in healthcare is access, where the system is in a way that you pay for you to access the services. And that's a big problem because most people also don't have jobs and they don't have enough money to pay for this testing and these lab tests. You find people mostly, if they don't have the money, they don't even go to the hospital because they need to pay, and the money which actually they don't have. So access is also a major issue. Unlike the US where you get treated and then they send the bill home. That's also a big difference between the US and Kenya. So we hope that things will get better at some point, We can't lose hope. There's hope. You have to be hopeful. All right, bye. Practice, I've had to experience upward mobility in terms of skills training and education, where I've had trainings on infection prevention. I'm an infection prevention focal person, and that I was trained by WHO during the Ebola outbreak in West Africa. And that's when I got to work in an Ebola setting where we did mostly a treatment in a Ebola treatment unit, and also we did recovery of services during that outbreak. And then I also have short trainings on management and also finance for non-finance managers, and also problem solving in entrepreneurship. We've been for others and we make the world a better place. And that's how we roll, and God bless you so much. I look forward to maybe at some point meeting you in person, and at least we have these conversations, and I know this is for good. So I wish you the best. God bless you, and see you next time.